Good evening, I'm Julie, and welcome to tonight's news. Our top story, the H1N1 influenza virus, also known as the swine flu, continues to make headlines as health experts around the world work to contain its spread. The virus, which was first identified in Mexico earlier this year, has now reached global proportions, sparking widespread concern. The Centers for Disease Control and Prevention, the CDC, has confirmed thousands of cases in the United States, with authorities urging the public to take immediate steps to protect themselves. In tonight's segment, we'll be discussing the ongoing situation as well as what you can do to protect yourself and your loved ones. But first, we're joined by Oscar, a local resident who's been following the news and has some questions and concerns about the H1N1 virus. Welcome, Oscar, and thank you for joining us tonight.
Thanks for having me, Julie. It's definitely a bit worrying with everything happening so quickly. I've been hearing a lot about the virus spreading. It seems like a lot of people, especially young folks like me, are getting really sick. I just don't know what I should be doing to keep my family safe.
You're not alone in feeling concerned, Oscar. H1N1 has been spreading rapidly, especially among younger people, and public health authorities are closely monitoring the situation. There have been thousands of confirmed cases, but there are steps we can all take to prevent the virus from affecting us. Let us talk a little bit more about what H1N1 is and why it's particularly concerning. H1N1 is a strain of influenza that primarily affects young people, including children and young adults. Though many of those affected experience mild symptoms similar to seasonal flu, such as fever, cough, and sore throat, there are concerns about severe complications, especially for vulnerable groups like pregnant women, the elderly, and those with pre-existing health conditions. So, Oscar, you're absolutely right to be thinking about your family's health. One of the most effective ways to protect yourself and your loved ones is through vaccination. The vaccine for H1N1 is becoming widely available in many areas, and health officials are recommending that everyone get vaccinated as soon as possible.
Yeah, I've heard the vaccine is important, but I'm also a little unsure about it. Is it safe? Will it protect me from getting sick? I know people have mixed opinions on vaccines, and it can be confusing.
That's a great question. Health experts have made it clear that H1N1 vaccine is both safe and effective. The vaccine has been tested thoroughly, and clinical trials have shown that it provides significant protection against the virus. In fact, getting vaccinated is one of the best ways to reduce the risk of both contracting and spreading H1N1, especially if you're in a high-risk group. The vaccine is available in two forms, an injection and a nasal spray. Both are effective, but the injection is typically recommended for most people, particularly those who are pregnant or have weakened immune systems. For most people, the vaccine should be well tolerated, but as with any vaccine, there may be some mild side effects such as soreness at the injection site or low-grade fever.
Well, it's reassuring to know, but even with the vaccine, are there things I should be doing to stay safe? I mean, it feels like there's so much conflicting advice out there about what I should do or what I shouldn't do.
You're right. There's a lot of information floating around, and it can be difficult to separate the facts from the rumors. But health experts are clear on some fundamental guidelines for preventing H1N1. First and foremost, practice good hygiene. Wash your hands frequently with soap and water for at least 20 seconds, and if soap and water aren't available, use a hand sanitizer with at least 60% alcohol.
Okay, so frequent hand washing is key. What else should we be doing, especially with the holidays coming up? I know people will be gathering in large groups, and that kind of worries me.
Yes, large gatherings can increase the risk of spreading the virus, so it's important to take precautions. If possible, try to avoid crowded places or limit the number of people you interact with in close spaces. If you do need to go to an event, practice social distancing where possible. Stay about 6 feet apart from others, especially if they're coughing or sneezing. It's also a good idea to avoid touching your face, as the virus can enter your body through your eyes, nose, or mouth. If you're feeling sick, it's best to stay home to avoid spreading the virus to others, and don't forget to cover your mouth and nose with a tissue or your elbow when coughing or sneezing to reduce the spread of respiratory droplets. Masks can also prevent the spread of the virus, particularly in situations where social distancing is difficult. In areas where the virus is spreading rapidly, health authorities may even recommend wearing a mask in public indoor spaces, especially if you're not feeling well. Now, in addition to personal hygiene to take in the home to prevent the virus from spreading, Keep frequently touched surfaces like doorknobs, light switches, and remote controls clean, and encourage everyone in the household to wash their hands regularly.
It seems like there's a lot to stay on top of. I mean, is there a way to know when it's time to seek medical help or when I should really be worried about my family's health?
That's an excellent point. If someone in your household develops flu-like symptoms, such as high fever, body aches, or sore throat, it's important to monitor their condition closely. For most people, the symptoms will pass with rest and fluids, but there are certain signs that should prompt a visit to the doctor or hospital. If someone is having difficulty breathing, experiencing chest pain, or showing signs of severe fatigue, it's important to seek medical care immediately. These can be signs of complications such as pneumonia, which can occur with H1N1 in the more serious cases. Pregnant women, young children, and those with chronic health conditions should contact their doctor as soon as possible if they suspect they have the virus.
Wow, that's really helpful information. I'm definitely going to be more vigilant about keeping my family safe. With all the panic, it's hard to know what's real. I mean, how do we avoid getting overwhelmed by all the constant media coverage?
That's a very valid concern, Oscar. In times like these, it's important to rely on trusted sources of information such as the CDC, the World Health Organization, and your local public health departments. They're providing regular updates and guidelines based on the latest scientific research. While it's understandable to feel anxious, staying informed with reliable facts is key to managing your concerns and protecting your loved ones.
Thank you for all this advice, Julie. I feel more confident knowing what steps to take, and I'll make sure to stay updated on the latest recommendations.
You're very welcome, Oscar. It's all about being proactive and staying informed. We'll continue to monitor the situation and provide updates as new information comes in. And remember, if you or someone in your family is feeling unwell, don't hesitate to contact your healthcare provider. Now, for those who are interested in getting vaccinated or learning more about H1N1, many local clinics are offering flu shots, and you can check with your doctor or local health department for the most up-to-date information on vaccine availability. That's all for our special report on the H1N1 outbreak tonight. We want to thank Oscar for sharing their concerns and helping us shed light onto the precautions we all can take. Stay safe, take care of each other, and we'll be back with more updates after the break. Welcome back, everyone. Next up, we have an expert epidemiologist that is here with us to talk about H1N1 and how it will affect you. Good evening, and thank you for joining us. My name is Jenna, and tonight we're diving into the epidemiology of H1N1 influenza, often referred to as the swine flu. Understanding how it emerged, spread, and impacted global health is critical as we continue to learn from past pandemics to prepare for our future. H1N1 first gained global attention in the spring of 2009 when cases of a novel influenza virus were identified in Mexico. Genetic analysis revealed it to be a unique strain, a mix of swine, avian, and human influenza viruses. This genetic combination gave it the ability to infect humans and spread rapidly. The pandemic was declared by the World Health Organization, or the WHO, in June 2009, making it the first influenza pandemic of the 21st century. By the end of the pandemic, in August 2010, the virus had infected an estimated 11 to 21% of the global population, with an estimated death toll ranging from 151,000 to 575,000 people worldwide. Now let's break this down further. H1N1's transmission followed typical influenza pathways. Respiratory droplets expelled during coughing, sneezing, or even talking. Its rapid spread was facilitated by modern air travel, densely populated urban areas, and a lack of pre-existing immunity in the population. Demographically, the virus showed us some unusual patterns. Unlike seasonal flu, which disproportionately impacted the elderly, H1N1 caused severe illness primarily in younger individuals, particularly those under 65 years of age. Pregnant women, people with chronic conditions like asthma or diabetes, and immunocompromised individuals were also at higher risk for severe outcomes. Geographically, cases were reported on every continent within weeks. However, disparities in healthcare infrastructure significantly influence mortality rates. Countries with robust surveillance, vaccination programs, and healthcare systems fared better than those without. One key element in controlling the pandemic was the development and distribution of the H1N1 vaccine. By late 2009, vaccines were available and public health campaigns encouraged widespread immunization. However, vaccine uptake varied due to logistical challenges, public skepticism, and uneven distribution, especially in lower income countries. Despite its relatively low fatality rate compared to other pandemics, H1N1 demonstrated critical vulnerabilities in global health systems. For example, it highlighted the need for better surveillance of zoonotic diseases, illnesses that jump from animals to humans, and the importance of timely vaccine production. Finally, there's an important takeaway here. Pandemics don't just end when the virus stops spreading. Long-term surveillance has shown that H1N1 strain remains a part of the seasonal flu influenza viruses today, continuing to circulate and evolve. In conclusion, H1N1 was a wake-up call for the global community, a reminder of how interconnected we are and how quickly diseases can spread in our modern world. Preparing for future pandemics means investing in research, strengthening public health systems, and building public trust in science and vaccination. Thank you for your attention tonight. Remember, understanding our past is the key to securing a healthier future. Stay informed, stay safe, and as always, stay prepared.